everyone. We are here for a debate, and our topic is: should assisted suicide be legalized? I am Priya,
I'm Harjit Kaur,
and I'll be speaking against the motion.
and I'm going to be speaking for the coordination. So I wanted to start by saying to Priya that suicide or anything related to health it depends upon a personal choice of the individual whether they want to live or die. If they are facing an incredible situation or a pain, they would prefer to die rather than living their life in the best way.
However, it's not the decision of a medical professor to decide if that person should live or die, even if that person is feeling or experiencing an unbearable pain. But if that person has the willingness to live, I don't think so that medical profession should concede or go against the rule of do no harm to its patients and kill that person.
Okay, let me just give me an example. Like I'll give you an example. If a person is suffering from a brain tumor or a cancer and is in the last stage of his death, will, as a doctor, are you having a chance that you will make his condition a better way, or you will try to make him survive? Because he's in the last stage, and he will have his personal choice to he will have his personal choice to be dying because he has faced a lot of pain during that whole procedure of his life.
Exactly. Pushing the person to its limits would only make the situation worse. If he or she is on the last stage of their life, they want to live that extra life and not feel a burden to their families or the medical profession. So when you talk about brain tumor, that person already knows he's terminally ill. However, if you make them feel that you are being very ill and you need to be exposed or decomposed. So this is how, if we make that person feel, they'll be emotionally vulnerable and feel that they are a burden.
Even there would be a family scenario where they are connected emotionally and they would have a lot of financial issues, but still he's trying to survive his life. But at the point, there must be a situation where the family is ready, like the family is even thinking of backstage and a second step behind, like this person could not survive more than a year or a period. But what will the doctors give a perfect answer to them or not?
Respected opponent, I believe that you're going wrong about how a patient should be perceived. It's not only about the illness, it's also about the many factors which come along with it. If assisted suicide is legalized, it won't only be characterized into terminally ill. However, it would expand to people who are mentally unstable also. So will you kill them too?
If a person says you directly that I don't want to survive now because I'm facing a lot of issues due to this medication, then what will you do now?
Won't you ask them the reasons why they want to kill them and help them live a little longer on this beautiful earth? Why would you push them to kill themselves?
Because in their mindset they have been clear that there is no way that they can recover fast as soon as they know. Like these conditions are being processed a lot.
As a fellow individual, I would make the person realize that this is not the end of the world. Howsoever time is left with you, you can utilize it to make the world a better place and enjoy the life which you have.
At the end, I believe that as every individual has the right to speech and freedom of speech, it's totally a personal choice whether they want to live or die.
Respecting your opinion, I want to conclude our debate. As I conclude, I want to say that pushing a person to assisted suicide won't only make them emotionally weak, but also take away their freedom of speech, because it's their own right to decide what they want to do with their life. However, it's not with us, because just because we think that the pain is unbearable.